Hi, my name is Dr. John Repole with Jacksonville Health and Wellness Center, and today we're talking about depression, happiness, stress, and anxiety, and some holistic ways that we can go about making some monumental changes in the way we think, the way we feel, and our actions and our behaviors. So we're going to start out with where the research tells us our quote-unquote happiness comes from. So I think we can use maybe a concrete example. So I have patients who come to the office, and we oftentimes, one of the first questions that we ask them is, can you grade your overall sense of well-being or your happiness on a scale of 0 to 10? And of course, this is extremely subjective, but 0 would be clinically depressed and 10 would be, overjoyed or elated. And oftentimes people will come up with a number and say it's 6 or 7 out of 10. So what the research shows us, we're going to take two extreme examples. The first example is somebody who grades their overall happiness at, say, a 7 out of 10. And let's say that they just found out that they won the lottery. And if we were to ask them right after that, what's their happiness level, we can expect that they would probably grade their happiness at a 9 out of 10 or maybe even a 10 out of 10. But if you were to follow that person maybe a year or two later and ask them again what their happiness quotient is, you're going to find out that they may say again, now it's at a 6 or a 7 out of 10. And that's primarily because our happiness we can't buy from external, tangible items. Our happiness is an inside job. If we take another example, which is kind of on the extreme side here, and we look at another person whose happiness quotient, say, is a 6 out of 10, and they're walking down the street, and suddenly they get hit by a car, and they become a paraplegic. You would expect if we asked them that subjective question, what's your happiness quotient or set point, they would say that their happiness quotient now is a 1 out of 10 or a 0 out of 10. But if you follow some of these paraplegics and some of these accident victims a year or two later and you ask them the same question, it's going to go back up to a 6 or a 7 out of 10. So in other words, what's happening here is that the research tells us that our happiness waxes and wanes throughout the day, throughout the week, throughout the month, throughout our decades, and it goes up and it goes down. But if you were to average it all around, you're going to come up with an overall sense of well-being and happiness that you kind of grade on a regular basis. And that is what they refer to as your happiness set point. They believe that the set point is influenced by three major factors. The first one is genetic, and we'll come back to that in a moment when we talk about some holistic treatment. It contributes about 50% to our overall well-being and happiness. There's another section that contributes to our happiness, and this is really events in life circumstances. And the events in life circumstances could be anything from a loss of a loved one to a divorce or a loss of a job. And the interesting thing here is that all of those type of events we tend to think have a huge weight, but research shows that they only contribute about 10% to our overall well-being and happiness. Where we really want to focus in on is this next section, which contributes 40% to our overall well-being and happiness levels. And this is the thoughts, the words we speak, the actions, and our behaviors. In other words, these are things that we have complete control over, and we can possibly just call it in a nutshell our diet and our lifestyle. The research shows that there's a whole slew of things that have been listed. So there's mindfulness techniques like breath work, there is journaling, there is practicing gratitude, random acts of kindness, different types of exercises that you can engage in, eating a strong, healthy, whole foods diet, and a whole host of other activities that people can do, sleep hygiene and so forth, that can be practiced that are under our control. So what we really want to do is work on this 40%, which is really building this extreme foundation of diet and lifestyle. Now, my aha moment came because yes, I know we should be grateful, and I know I should be practicing, say, breath work, but we have an intellectual discourse about a lot of these things, but if you don't practice it and habituate it, then you can't rewire your brain. So, to give the analogy, if you just think about doing exercise, you're not going to get a cardiovascular benefit. Or if you do 1 minute of cardiovascular training, you're not going to get a benefit. You actually have to do it in order to get it. And the same thing happens here with a lot of these habituated actions that you need to be taking. You have to practice it. So if gratitude is for you, you practice gratitude every morning for 5 minutes. You have to pick something that kind of strikes a fancy with your individuality. So some people may be more apt on doing, say, a gratitude journal, and some people may be more apt on practicing random acts of kindness throughout the week. And there's a whole list of strategies that you can get. A recommendation would be to buy the book called The How of Happiness, and it gives 12 strategies, and you can pick 1 or 2 strategies and begin to implement them and practice them on a weekly basis. The 10% is really what most people concentrate on, is they catastrophize this 10% and make it feel like there's a 90% weight from these events, when really all they're doing is reliving the past over and over again, and it's illusionary, right? It's not really happening, and they're not living in the present moment. The only stress that's being created is the fact that they're thinking about it over and over again. And this is really where life coaching, mental health counseling comes in to kind of help to break some of these patterns and shift our perspective, and maybe take what is referred to as a non-dualistic approach, and looking at the world as love and everything else that we can't understand as simply a call for love, as an example. But there's many ways and many therapies that can be used in order to kind of integrate a perspective shift in this 10%, so that way we don't catastrophize it where it's taking up the dominant amount and contributing really what it shouldn't be contributing to our overall well-being and states of happiness. As a functional medicine health practitioner, one of the areas that I think is interesting that we can start to concentrate on is now this 50% portion, which is that quote-unquote genetic related portion. And this has to do with the cocktails of hormones that are produced in the body. This has to do with the cocktails of neurotransmitters that are produced in the body. And we can begin to test for these things and look at the adrenal glands as an example that produce the stress hormone called cortisol. Get a window and see what it's doing, and then begin to put some therapeutic intervention. We can look at amino acid therapy. Amino acids are the precursors to a lot of these neurotransmitters. So the medical establishment focuses in primarily on serotonin, which is this neurotransmitter that they kind of suggest that it contributes to our general sense of quote-unquote happiness. But really, our body produces lots of neurotransmitters like serotonin and dopamine and epinephrine and GABA. And what you're really wanting to do is to take amino acid therapy, which are the precursors for the body to be using to be making these neurotransmitters, in the right balance, in the right ratios. The testing's at its infancy, but we can look at the amino acid therapy, we can look at the amino acids that the body's producing, and in some labs we can actually look at the neurotransmitters as well. And we take that information with the hormones and we begin to work out some sort of, say, as an example, a supplemental regimen for that person. Another area of major concern here is sugar regulation. We know that when people's sugar drops, they become irritable. These are people, they call them a fast oxidizer. They burn their food like newspaper, and they need to scavenge and eat food really quickly. One of the strategies that we employ in helping patients with depression is putting them on a whole food, plant-based diet. We ask them to eat frequently, and we'll add extra plant-based protein to their dietary regimen. One of the reasons why we use a whole food plant-based diet is primarily because of the toxicity load is so low in plant-based foods as compared to, say, processed foods and animal-based products. Another reason, too, is because of the metaphysical toxins that are spewed inside these animal products. So we have, raging hormones from the way they're treated, to the hormones that are put in them, to the antibiotics that are put in them, and then of course these metaphysical toxins of fear and terror that are permeating their very flesh. And literally and metaphorically, when we eat these dense foods like processed foods and animal products, we ourselves become extremely dense. When we open ourselves up and when we're suffering from depression by eating foods that are less dense, that have more life in them, raw foods like fruits and vegetables, we ourselves literally and metaphorically become less dense ourselves. And it allows us to unlock the potentials, of the human capability. So we want a multidimensional approach to depression, to stress, to anxiety, and we want that to be based on a foundation of diet, whole food, plant-based diet, regulation of blood sugar by eating frequently, extra plant-based protein. We want to make sure people are engaging in lifestyle behaviors that they can habituate. Exercise has been proven to be just as strong as Prozac if it's done and it's habituated, as far as helping to decrease the levels of stress and feelings of depression. We want to look at that area that we put so much weight on, those life events and circumstances, and see if we can start shifting our perspective and working with a holistic team and a mental health counselor to be able to integrate that. And then on that 50%, you really want to be working with a functional medicine practitioner to be looking at some of the new testing that is available, so that way we can begin to put some therapeutic intervention to help create a very dimensional treatment plan. In our office, we use a life coaching, a mental health counselor, a nutritionist, myself as a functional medicine holistic practitioner, fitness training. But that's the treatment plan, that's really needed to integrate for somebody suffering with depression. If you have any other questions or would like to find out more on how we can help you, don't hesitate to call us or email us, and we would be happy to answer any questions that you have.